The Washington State Board of Education is responsible for K-12 system health and issues a report annually about that. We do that in coordination, though, with our partners from early learning through higher education. And the purpose of the indicators that we've selected across those organizations, from boards, staff, state agencies, and the legislature itself, is to really come up with the best combination of indicators and accountabilities so that together we ensure that our youth in Washington, from babies through adulthood, are achieving the outcomes that they desire so that they can thrive as Washington State citizens.
When the educational system health indicators were established, part of the discussion at the time was kind of based on an analogy to the healthcare system, where when you have a patient who is unhealthy, you have a set of vital signs that you evaluate as a healthcare professional to determine how serious the situation is. And it was observed that in the educational system, we really didn't have sort of an equivalent set of vital signs or key indicators to help us have a kind of a shared framework and understanding of how we were doing in the educational system, not just K-12, but really kind of P20 continuum. How do we evaluate ourselves moving forward?
All those things. So these are the reasons that we look at these, so that we can take that child from the beginning entry level of school all the way to the end, on into a career world, and then we want to know what have they done once they've left high school, so that they have ensured that they are now ready to become fully productive members in society.
As helpful and productive as our analysis of this data has been, I think it's also important to keep in mind that we don't want to spend all of our energies focused on the data itself, which is basically just a description of the symptom. Most of our energies as policymakers should be focused on analyzing root causes, and that's where we think our work in identifying and rooting out opportunity gaps for students in our system really comes into focus.
As a system, as a whole, we still see significant inequities in the way our student populations are performing. And as a board, we are having deep conversations about the fact that these inequities are really being driven by opportunity gaps that exist in our system. Not all students have access to teachers who have the experience, who have the support themselves in terms of the professional development that they need, in terms of getting the curriculum materials, in terms of having the time to really meet their needs. And so we're realizing, that being as an example, that we really need to attend to what, in terms of the system, are the opportunity gaps that exist that are driving these historically persistent achievement gaps.